Hi, Alyssa. Thank you so much for coming in today.
Hi, thank you for taking the time to see me.
Well, I'm Taylor, and I'm the SLP that's going to be talking to you today about your upcoming laryngectomy. And this is my student, Sheridan, and she's also going to be talking to you about some changes and some options. So, the first thing that we're going to talk about is what's going to anatomically change. So, what's actually going to be changed in your body, just from a physical standpoint. So, with a laryngectomy, your voice box is going to be removed. And your voice box is what we call the larynx, and it's the home of the vocal folds. So your vocal folds come together and they vibrate and they make your voice, and that's how you talk. But your voice box or your larynx is going to be removed. And you're going to have a hole. It's going to be at the base of your neck, and it's called a stoma. And it's going to be about the size of a quarter. And you're also going to have your hyoid bone removed. And your hyoid bone is something that's kind of shaped like this, and it moves up and down, and it's also going to be removed. So that's kind of the basics of the anatomical changes. But now I'm going to explain what this really means. So, physiological, the function of these things, what those changes will look like. So, because of the stoma being in at the base of your neck, that's going to be your airway. So, your airway, the connection from your lungs to your mouth and nose is not going to be there anymore because your larynx is going to be removed. Instead, the stoma is going to be your airway. So all of your air is going to come in and out of that. So when you hold your breath right now and you go, it's not going to be like that anymore. You're going to hold your stoma. So because it's just an open hole most of the time, you're going to have to be really careful around bodies of water because if you were to fall in, then the water would just rush in type of thing. So we're going to have to be really careful about that. Another thing that's going to be different is your swallowing. So with that hyoid bone being removed, that's kind of what moves up and down and helps that swallow. So without that, you might experience some swallowing difficulties. And if that comes about, we're going to work together and work in therapy and try to address that. And one of the biggest changes that you'll notice is because your voice box is gone and your vocal folds are gone, your voice is not going to be there anymore of what you would call a voice. So that you're not going to have any type of vibrating vocal folds, but we do have some options for you of what your new voice could be produced from, and Sheridan is going to talk to you about those.
Okay, so your first option is going to be called an electrolarynx, and there's actually two types. There's a neck type, which is it looks like a little battery. It's about this big, and it's a little device, and the tip of it actually vibrates, and you're going to place it on your neck, and it's going to vibrate all the tissues in your neck, and then you're going to use these vibrations, and you're going to shape your speech with that using your tongue and your teeth, and then it'll come out as speech. And this is going to be the most common type of electrolarynx. There's also an intraoral device, and it's basically the same thing, but it has a little mouthpiece. So you're going to put it in your mouth, and through your mouth, it's going to vibrate your throat. And then you're going to use those vibrations to, create speech through your tongue, your lips, things like that.
Oh, okay, that makes sense. So, with the electrolyrics, are there things that are like an upside and downsides to this?
Yeah, so I'd say the biggest upside to this is that it's pretty easy to learn. You don't need a lot of training, and also there's no additional surgery. So that's a big upside. And it's also portable and convenient. You can carry it around in your bag, your purse, whatever. And it also produces a clear speech sound. But some cons could be that it sounds robotic or monotone. It kind of sounds like a robot, some people say. It also needs to be handheld through your neck or your cheek. So if you forget it at home or something like that, you're kind of out of luck. It also requires batteries and charging. So if you forget to charge it, that could be. It's also harder to hear in loud settings. So if you're out at a restaurant eating dinner, it'll be a little more difficult to hear you. And then sound transmission as well can cause issues if you have a lot of tissue damage in your neck. So those are the downsides.
Okay, one thing I'm kind of concerned about or am worrying about is being without a voice completely. So
Mhm.
if I were to choose the electrolarynx, how long would I be without a voice, if at all?
Yeah, so that's a valid concern. With this device specifically, you can use it right after surgery. So as soon as you take out your larynx, we can start training you to use this device.
Oh, awesome. Sounds good.
Yeah, and then so we have another option called esophageal speech, and this is a voice production method that doesn't require any external equipment. It's just training you to speak in a new way. So this involves swallowing air into the esophagus and then forcing the air back up, and then this air actually vibrates the tissues in the esophagus. And then you can use your tongue, teeth, and lips to shape this into speech. Um, but it's important to note that this technique is really difficult to learn, and I myself can't even do it, and some people never learn to do it. So it all depends on the individual.
Oh, okay. So that one sounds like it might be a little more natural sounding, I guess. Would I
Mhm.
sound like a robot if I did this one, or would it be different?
Yeah, so this one is more natural sounding than the electrolarynx, and you're capable of some more inflections. So there's natural like ups and downs of speech. It's gonna make it sound more natural. And then other upsides to it is that you don't need any additional equipment or surgery, and it's also cost effective. But some things also to require is that, like I said, it's really tricky to learn. Some people never learn it. It makes conversation slower because you have a limited air supply. It can be quieter in noisy environments, and it can sound a little monotone sometimes. So definitely things to consider.
Okay, yeah, for sure. So after the laryngectomy, seeing as though like with this option I have to train a lot for it, would this be like as immediate as the electrolyrics, or would I have to wait a little longer to have my voice back?
Yeah, so for this one, we have to wait for all your structures to heal completely. This looks different for everybody, but it typically takes about 2 to 4 weeks for everything to heal up. And then once you're all healed, we can begin training for that.
Okay, that makes sense.
Yeah. And then the last option is going to be tracheoesophageal speech. And this is a speech method that involves making a small, another additional puncture between your trachea and esophagus. So it's just going to be a little hole. And then into that hole, we're going to insert a little tube into the puncture. And this will allow the air from the lungs to flow into the esophagus. And this will vibrate those tissues in there and allow you to produce speech that way.
Well, okay, that makes sense. So is this one more complex than the earlier options we discussed? How is this one better, worse than the others?
Yeah, so like the other options, there's also going to be pros and cons to this one. I'd say the biggest con is that since you have another hole in your neck, it's going to take regular cleaning and maintenance. So typically every day you're going to have to change it out and switch it for a new one. But one of the pros is that it's also very natural and fluent sounding. It's generally easier to learn for most users. It makes your speech sound more continuous and you get less tired, most users say. And your speech is easier to understand by a lot of people. But another downside of this, there's a lot of medical follow-ups because, as I said, you have a hole in your neck, so you're gonna need to go a lot of follow-up doctor's appointments. And then there can also be leaks that occur through the stoma, which can cause coughing or infection. Doesn't always happen, but it's always a risk. And then you also need to cover your stoma to speak. So some users don't prefer that.
Okay, so this one kind of has a little bit more of a complex element in there with that extra puncture wound. So,
Hmm.
with this one, how soon can I use the tracheoesophageal speech after surgery?
Yeah, so this one as well, it all depends on how quick you heal up. Most patients, it usually takes them 1 to 2 weeks until where there's no swelling, and then your anatomy tolerate a voice prosthesis in there. So it all depends on when everything's all healed up.
Oh, okay, thank you. That makes sense.
Yeah.
I wanted to mention that we know that this is a lot and this is not news that a lot of people want to hear or even consider. And it sounds like you're being really open to it, which is really good. Typically, the people that are more motivated to have a better outcome do have a better outcome. So, I just kind of wanted to mention that there are different supports that you can get. So there are support groups of people that have had laryngectomies, or you can find some resources online about experiences that people have had and kind of go more in depth about what we've talked about today, if that's something you want to do. And then I'm going to give you a handout that just reiterates everything that me and Sheridan went over today. And if you have any questions, you can always reach out and ask.
Okay, thank you so much. I really appreciate your time and your transparency and exploring all the options with me.
Yes, thank you for meeting with us.
Yeah,
Have a
thank
good
you for your
day.
time. Bye.